All right, good afternoon. I'd like to call this meeting to order. Today is Wednesday, January 17th. If we can get approval of November 29th, 2023 regular Board of Health meeting minutes.
Move to approve the November 29th, 2023 regular Board of Health meeting minutes.
Second motion.
Have a motion and a second. All in favor, say aye.
Aye.
Aye. Any opposed? We'll say the ayes have it. Okay, let's move on to the next one.
Move to approve the December 14th, 2023 special Board of Health meeting minutes.
Second that.
We have a motion and a second. All in favor, say aye.
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 All right, the ayes have it. Let's go with public comment. Any public anybody here? I don't see anybody online.
So if you wish to provide public comment, go ahead and raise your hand now in the Zoom app, or otherwise you can press *9. There was no written public comment.
There was no written, okay. All right, we'll close public comment. Senior staff comments, if any.
Really? Come on.
We're on the agenda.
All right, moving on to item 5, unfinished business.
Yes, the district administrator recruitment. So we did not have a meeting in December. And then we tried to get one scheduled for January, but we were not able to we had too many scheduling conflicts across all of our committee members. However, we were able to push forward the survey that was, the board had agreed to at the November meeting, the all staff survey, to kind of understand their thoughts on what our future district administrator should look like. And so what I've asked, although we're still collecting responses, is for Amanda, our lovely communications manager, to come up and give you all a preview of some of those survey results. But then we expect to have those hopefully completed in the next week and then bring them back to the recruitment committee and future board meeting to share. But since we have some data, we wanted to share.
Yes, hello everyone.
Hi.
I'm Amanda Mason, as you probably know, your communications manager. So there was a lot of information to go through. We only had 25 responses so far, so we definitely are hoping to get a lot more. What I was able to glean from that was trust, listening, build, support were some of our keywords that we were able to find. There's so much good feedback that I think you all would love to hear about it, but we just want to make it a little more condensed.
Amanda, I just have one question. I don't mean to interrupt. Did that come from staff and where did a lot of that information come from?
So the questions were built by myself, the communications team, as well as our performance management team and our HR team, which was Brandy. She's a team of many. And so we wanted to come up with several questions that weren't leading, that were just information gathering sessions. And so what I am able to share with you only from the 25 responses though, so just keep in mind, we are still waiting for several more. I did find that 85% of our staff, and this went out to all staff last Friday, and it also went out again on Tuesday. What we were trying to do too, just for a disclaimer, find the right platform in order for everyone to be able to use to feel like they could fill it out anonymously. And so working with our IT team, they said that SurveyMonkey was the best way to not search any IP address. And so we really wanted to make it a safe and comfortable experience for all of our staff, because we want honesty, we want details, and we want thought. And so 85% of those 25, again, supported humility over confidence when asked about a certain different qualities. They saw that 88% valued innovation over tradition and being pragmatic. 69% loved more of the relationship side over systems. So still there was a little bit close to half and half. Again, this is just a small percentage of all staff. And then we also have, as I'm looking at our last quality of leaders, when looking at change leadership versus change management, how we described it to all staff is change leadership involves actively planning for the future with a clear vision, while change management focuses on dealing with practical challenges and responding to changes as they occur. So we had 72% that went towards change leadership. So it's been insightful at least to get some of the information. So we'd like to give you a voice from staff. I think that'd be very valuable moving forward, but we still have a lot more that I'd like to get some information from.
It sounds like everyone wants to look at long-term, short-term, midterm, but also be able to pivot and have relationship building. Am I hitting it kind of a little bit or?
Yeah, there is a lot of relationship building. I mean, I think to be honest, here at BFHD, we definitely do love forming relationships. Some people might call it kumbaya, but we care about people. You know, we're people that serve. And so giving that opportunity and having a leader who really cares about our staff as well as the community is valuable. And I feel like I could have more information to give you that would be better spoken for all staff after looking through more information. So, thank you.
Motion?
That's about a 10% response rate. Was it, how many people received the survey?
All staff, so around 130.
So we got 25. What I wanted to also share is that we did get applications in, and so in our executive session under 9C, review qualifications of an applicant for public employment, we'll be actually reviewing and discussing some of those applications here today. So it's kind of like a part one here as far as the recruitment movement, but then discussing further applications in that executive session. Okay. And I'll bring part of that. So.
Any other questions?
No, just a quick comment though, Janae, I know that you've been doing this for how long now? How long have you been in this role exactly? 6 months or?
January 6 months, I'm coming up on,
That's-
yeah.
Yeah, I got that number right now. So no, I think that was a good thing. I appreciate everything you've done. And once again, I know I've talked to you before personally and stuff like that. And if you're looking at applying, this is the time to do it. And I would encourage you to look at that strongly and stuff and move forward. I mean, I think we can get a few more applicants. That would be a great thing. I'd like to see a pool.
Yeah.
I do like to see people, I think it's always been constructive where you have financial business experience. You have to like the sometimes as the leader, you have to shut up and listen.
Yeah.
And make those relationships. And I do think midterm, long-term is important as well as being able to pivot. We pivot. I call our office, we pivot every single day on something. And so I think you have to learn how to pivot and be able to go ahead and adapt and make those positive changes. So, yeah, I think you're doing that.
I would offer that. First of all, I appreciate your confidence in that.
Yeah.
It's been a lot of work in the last 6 months and honestly in the last couple of years.
Yeah.
There's some unique challenges that we face here at BFHD. And so I don't, I think I need to reflect on that a little bit more.
Yeah, do that. And like I said, I'll start getting the word out. Heck, I was joking. I was gonna say, I'll put my hat in the ring, but no, can't do that. I can't have him tell me what to do. I'm joking. But anyway, no, let's move forward and stuff like that. I'm eager to see the applications and hopefully we get a few more and just not one or two. We need to really get out there. And how are we marketing that? Are we gonna learn that in an executive session? So we can.
Brandy can talk about now some of the areas that she has been posting, but we will be reviewing the applications and some of that in our discussion.
Okay. On the marketing side, are we getting the word out here locally more? Are we going on a broad base more national or?
Locally with our community members, WSOFL and WSPHA state at the state level. So,
So I was wondering, can we, do we get for a recruitment, if we're not getting that many applicants, I know that we've done that before and we've been pretty successful too at the city or at the county, is, hiring a recruiting agency to a consultant to go out there too. I mean, that way you just get a big broad range. I think that would be a good thing. Sometimes, getting some really good talent in here, would be a good thing too. I just want to open it up to make sure that we get somebody in here that will do well and have those relationships and just come in here on a positive note and really be eager to work and do, make it go to the next better, good, make it up to the next level.
Let's take a look at our applications in exec session.
Yep.
And then after you guys have had a chance to review those, we can talk about next steps, come out of exec session and talk about next steps. Yeah.
So is that a possibility, Brandy, is to, instead of just doing it more local or maybe at the state, is to, we'll look at the applications, but if that doesn't work, maybe bring some type of recruiter consultant.
Absolutely.
Okay.
Any other questions? No? All right, moving on. To new business, health officer update.
Thank you. You gotta have my slides up there. I have to remember what I wrote. So the first thing I wanted to chat about was just a little bit of positive public health wins. So I wanted to shout out for our team, Kelly Harnish and her Healthy Living team that's been working on the opioid harm reduction stuff for the past number of, thanks. the past number of months getting naloxone and stuff into schools. So, she's been doing a wonderful job here. And then as you can see, the state is taking this on also. So it's a new state program to make sure that all the high schools get naloxone where they need it. So that was a positive win. So next slide. I just wanted to update you on a legislative bill that is coming out with this legislative session. It's SB 5983. And the idea here is to make sure that we can sort of take care of our customers where they need to be seen. And so a lot of times that means going out in the field or sort of in a non-traditional setting in order to get them the medication that they need. So the example here is for syphilis. So there's been quite a large, I don't know the percentage, but quite a large increase in the number of congenital syphilis cases in our community. It's gone, from 0 up. And so the goal with this one is to allow MAs to be able to go out into the field and deliver the medication. So it's an antibiotic injection that they would typically have to do in-house here. So more like in a traditional setting, but to allow them to go out into the field and to do that, where our clients might be. So that's coming up before the executive or the legislative session later this week or next week. Heather is actually going to provide some testimony on that. So I'm very grateful that she was willing to do that there. And our goal is to make sure that we can, like I said, treat people. It can be kind of hard to, first of all, identify who these people are. And then second of all, you have to drive them in here, as opposed to being able to, us go out there and meet them. So another issue that may have some impact on our community is one of our local ID providers has moved out of state. So that leaves 3, if I'm counting right, at Kennewick. There's going to be a 4th coming later this year, but that has provided maybe a little bit of bottleneck for some of the sort of tuberculosis, HIV type treatment things. But we're currently working with the Department of Health and seeing if we can find some kind of innovative ways in the meantime to connect people, remotely, or maybe with the University of Washington, or maybe some telehealth or something like that, to make sure we still solve that need. I wanted to show you the graphs. Last time I just kind of mentioned what the numbers are. Maybe next time I'll make them a little bit bigger. But we have 3 graphs: one for influenza, one for RSV, and one for COVID, to just show a few things for how this is reflected in our community. First one here is influenza inpatients and ED visits. You can see there was a little bit of a spike there, but kind of coming back down. Next slide. RSV, also nothing like you saw last year there in January. So I guess time will tell. This probably lags by a weekish or so. So we'll see, if what this is going to look like next week or the week after, if that's going to keep going up or go back down. Next one. And COVID still looks pretty flat there. So any questions about any of those? Do you like to see the graphs as opposed to me just telling you?
No, I think it's good.
Okay. Next slide. Yeah. I want to congratulate Heather too. She applied for a prestigious a public health advisory committee role with the current governor's, I don't know what you call it, governor's group.
Public Health Advisory Board.
Yes, Public Health Advisory Board. And then she was selected. So this is a statewide search. There's probably what, 15 or 20?
20 of us on.
Yeah. So it's going to be a great opportunity for her to represent, BFHD and our community and the east side and communities of our size. Next slide. Minor housekeeping stuff. Kennewick Family Medicine has a residency program. There's something like 24 or 25 residents each year. So we were kind of brainstorming how best could we maybe work with them in terms of resident education. At the same time, how best could we utilize some of their expertise and their work to kind of take care of our community too. So a couple weeks ago, we had a meeting with one of their leaders. They were very interested in this, so we're going to continue the conversation of what this might look like or evolve to down the road. I want to shout out to 211. That's the phone number that anybody, residents of our community can call if there's a need for information on warming centers. Sort of with this sort of temperature. You can look it up online too, but 211 something that people can call. I wanted to ask you too, since I have a few minutes with us together, sort of what one thing that I didn't mention that you wish that I had, or any other feedback for how you would like me to structure these going forward each month. How can I provide you the information that you need from me?
I think it's fine the way you're doing it. Yeah.
Yeah, I appreciate the graphs. They're worth 1,000 words.
Graphs are good. Okay, I got it.
I'm more of a tactical, strategic type person.
Okay.
So next time we come back, I'll try to think of something that would maybe help.
Awesome.
us in your thing.
I'd appreciate it. Yeah, or you could always email me separately or whatever. Let me
Yeah,
know.
yeah, for sure. I appreciate the opportunity.
Okay, great. Thank you.
Thanks. All right, moving on to kit vapes increases. Vape.
So one of our presenters, Kelly Harnish, is gonna be here virtually with us, and then Aaron will be co-presenting over.
Good afternoon. Thank you so much for having me. My name is Kelly Harnish and I'm the Healthy Living Manager. I just want to talk a little bit about the work that our team, specifically Yahaida Lemus, is doing on youth tobacco and cannabis prevention here at the FHC. And she's really part of a larger regional initiative to combat youth cannabis and tobacco use. And then after I present, I'll pass it over to Aaron. Next slide, Eric, please. Just to give you a little bit of data, this is just as a note from our previous Healthy Youth Survey from 2021. It was administered again last fall and we'll be awaiting new results in 2024, so this spring. But this is the most up-to-date data we currently have. And it shows that as far as e-cigarettes or vaping is concerned, we see an increase in Benton and Franklin counties as children go through middle and high school, which is kind of to be expected. You can see that between 6th grade and 12th grade, the rate of e-cigarette use about tripled in that time period for our youth. There's a significant difference between the counties and the state as a whole, so we're doing better than the state as it is, which is the good news. And really it's showing that in 12th grade, just over 1 in 10 youth are using e-cigarettes as of the last time they were reported. Next slide. And then often we need to, kind of look at some of those positive factors. And so we look at mental health in youth as well. This is also from the Healthy Youth Survey, which will be updated again this spring. What we're seeing here is more troubling than the actual substance use data that I just showed. That in Benton-Franklin counties, we're seeing a trend of, roughly half of our youth feeling sad or hopeless almost every day for 2 weeks or more in a row by 12th grade. So that's a significant increase between the last time in 2018 that they were surveyed to 2021. There's also a significant difference between each grade level. So we know that sometimes mental health can kind of be a causative factor to substance use, and then substance use can exacerbate mental health challenges. So it's really something we want to keep our eye on and think about when it comes to interventions. Next slide. Next. There. As far as interventions are concerned, one way that we hope to intervene is through positive community norms. So these are a couple examples from a different county, but something that we're working on actively within our regional effort is a new communications campaign that's kind of modeled after this idea. And the idea is that in order to positively influence health behaviors, it can be really easy to focus on the dangers and the problems that we're trying to decrease. But if you really focus on the truth that most of our young people are not using nicotine and tobacco, that can promote healthier choices because kids just want to fit in. So if they perceive that everyone vapes, then they're more likely to try it as well. But using the science of the positive or positive community norms, we can grow those positive behaviors by providing evidence to kids that most youth are not vaping. So we're really working on a new campaign that should be coming out right before the next set of Healthy Youth Survey data that will be including those data sets into the campaign materials. Next slide. Oh, sorry, go back one, please, Eric. Thanks. And another way that we can positively impact youth is through the work that my colleagues Annie Goodwin and Miranda Sahagan-Baraza work on through the HOPE initiative. So that's healthy outcomes through positive experiences. And that really kind of is an evidence-based model that encourages connection as a protective factor for children and youth. So this particular example focuses on how to provide those protective factors for teens, which can be an antidote to, if they've had adverse experiences or mental health challenges that may make them vulnerable to substance use. These positive experiences like eating together every day as a family or as often as possible, sharing, enjoyable hobbies together, just talking with your team anytime you're together, listen to their feelings, acknowledge and think about their opinions. Those really go a long way. They make a lot of sense to a lot of us, but they're all good reminders that those things really build resilience in our teens and youth. Next slide. And for folks who have already started vaping or using tobacco, as part of our regional work, we're providing quit kits. And so this year, kicking off the new year, Yahida worked to get quit kits at our front desk and ran a campaign with our communications coordinator, Sandy, to promote that. And so as of last count, over 60 quit kits were picked up at the front desk. These include water bottles for hydration and other tools that really help people quit using nicotine or tobacco in a safe and healthy manner to kind of replace the hand to mouth, mimicking that. You would have a vape pen or a cigarette, having things like the gum or the toothpicks or the stress ball. And another thing on that, we got local media coverage during prime time, which we're really excited about. Next slide. And lastly, the Youth Summit is scheduled in March 15th. It's an event that really brings young people in to the conversation about kind of what their vision is about their health and about their community and what they see as far as positivity for the future. And it encourages them to really be active in making positive impacts in their community. So signups will be starting soon. And again, that'll be part of our regional effort to prevent substance use in youth. And I'll pass it over to Erin.
Thank you. Erin Hockaday, Senior Manager for Surveillance and Investigation. So I know I've come here a few times and talked a lot about some environmental health topics. And this one, I wanted to kind of highlight some of the struggles that some of our local schools are having related mostly to dangerous waste disposal of the vape products. Often when we bring up topics, in Carla and Kelly's world of how a topic impacts your human health, there's often a link to environment and the environmental, the health of the environment as well. We've been seeing through my school environmental health program, some really significant challenges. Schools have been seeing these. We've been working with them to try to find better solutions with not only here locally, but also with, state agencies like Department of Ecology who really regulate this area. It's becoming a really challenging topic for schools to figure out what to do with these vaping devices once they are confiscated. And we are, at local health trying to strike a very fine balance of we want them confiscated. We don't want them in the hands of the kids, but they're incredibly challenging to deal with once they are confiscated. So I wanted to go over a little bit of kind of the anatomy of a vape device in relation to disposal, just because it kind of plays into some of the complications of the disposal. So with a vaping device, much like anything, once it's in the possession of the district now takes full responsibility of it, which means that they are now bound by business waste regulations, dangerous waste regulations on how they dispose of it. So it's theirs now. They have to figure out what to do with it. Now, when it comes to dangerous waste disposal, the amount or the weight of the accumulated waste is going to determine what's called the school's generator status. So if you're a small business and you have dangerous waste to dispose of, you're either in one of three categories. You're considered either a small, medium, or a large quantity generator. And depending on which category you fall, the regulations you have to follow get more and more complex. So most of our schools, all of our schools right now are in what we call a small quantity generator status, which keeps things relatively simple in terms of getting rid of dangerous waste. If you bump into those higher categories, things get significantly more complicated and more costly. One of the complications of a vaping device is that the nicotine in the vape device is considered what's called P-listed waste. So that's one of the most dangerous types of acute hazardous waste. And it shrinks the amount you're allowed to have. You're only allowed to have 2.2 pounds of that on site per month, as opposed to 220 pounds of some more kind of generic chemicals. So they're not allowed to accumulate very much before it gets really expensive and complicated to dispose of. So this is presenting some problems, and I'll go over some of the challenges a little bit later. So in general, there are two different types of vapes. There are the refillable devices where the tank and the cartridge are removable. You can remove the battery. Now with these, the complication with this is that most companies that take dangerous waste want them to be disassembled before the school gives them to the company to dispose of. And that's creating some challenges with the schools because they do not want to disassemble and handle acutely hazardous waste. They don't have staff that are trained to do that. They're not often comfortable doing that. And we're saying, hey, here's this really dangerous chemical. Now we want you to fiddle with this thing and disassemble it. They don't want to do that. If they don't disassemble it, as well as the disposable type of vapes that can't be disassembled, then the entire weight of that device counts towards their generator status. So now they have to pay to dispose of the entire weight as opposed to that little empty cartridge. So you can see where there's no good choice either way. Can you go to the next slide, please? So that kind of wraps up a lot of the challenges, a lot of the complexity of what we're seeing and what we're trying to work through right now with the schools. And we are working closely with Department of Health and Department of Ecology to come to some solutions here, but haven't found an easy solution yet. So some of the challenges for our local schools, one, regulatory requirements for dangerous waste disposal are really complex. They're very complex. And if you've got an entity like a school, well, most people who are in these roles, that's not their primary role, is to deal with hazardous waste. They're a teacher, they're a science department head, but some of these things fall under their purvey anyways. It's a lot to ask to learn and know these dangerous waste rules. So we're trying to help them navigate by coming up with simpler, more accessible, documents to help them kind of navigate where they're at. Again, I talked about the potential increase in generator status as they accumulate these vape devices. And that increase means more tracking, more reporting requirements, more cost in general. Disposal is really expensive. Disposal of hazardous waste is very expensive. And right now, one of the biggest issues, not just in our area, but across the state, is that the disposal options are lacking for these. Right now, their only option is to contract really with a third-party service that will come in and take them to what's called a TDSR facility. We have a moderate risk waste facility in Franklin County, but they only accept household hazardous waste. They don't accept business waste. Right now, Benton County is in process of working with our solid waste division on permitting a new moderate risk waste facility in Benton County. So this is an area where we'd love to work closely with the county to really encourage that they take a specific type of waste that would help the schools find an option for more accessible disposal. It doesn't mean the cost goes away, but it's more accessible if you can just take it down the street as opposed to having to hire a vendor to come in all the way from Spokane and then pay the cost of, the increased cost to have this vendor come in from out of town. Staff and student safety, as I mentioned earlier, just this sheer fact of having to disassemble the devices is really concerning to the schools right now, and they don't really want to do that. The other piece of that is that those disposable devices are becoming far more popular than the removable cartridges. So majority of them are disposable. So not as many that they have to disassemble, but that means now they're paying more often than not paying for the full cost of the unit, the whole weight of the unit, as opposed to disassembling it. Can you go to the next slide? The other thing with disassembly is that they have lithium ion batteries in them. And if anybody's seen, pictures of lithium ion battery fires, they can be really dangerous. This is something that's kind of becoming more and more concerning, I know, to Department of Ecology, is if we're asking them to disassemble these devices, lithium ion batteries can be really dangerous if they're damaged. So this is just a really quick example of what happens when a lithium ion battery can get damaged. Essentially, in a nutshell, there's kind of a short circuit that can happen internally that can lead to something called thermal runaway. You go to the next slide. And cause some pretty nasty fires. And so we really don't want them messing and having to disassemble these devices, because any damage to those batteries, while the smaller batteries, these were probably caused by like a larger battery, like in a, a hybrid or electric car or something. Smaller batteries, you've probably seen in the news, the iPhone batteries a couple of years ago that were just melting down. Smaller ones won't necessarily lead to this, but they could start something that could be dangerous. So just the sheer fact that we may have devices that are sitting in the schools right now because they don't know what to do with them, or they don't know how to get rid of them, and they're accumulating, just concerns us through our school, environmental health and safety program. And our larger schools right now, especially, have been working really closely with us on solutions and making sure that we're not accumulating more than need to be. So unfortunately, there's no easy solution right now. We are working closely with the schools to come up with things like educational materials. They've asked for things like, hey, we just want a checklist on like how to safely disassemble them. Some of these simple things that we can do now, that's really about what we can do now, because there's no easy solution immediately. In the near future, as I mentioned, we're working with Benton County on getting their moderate risk waste facility permitted, and really trying to, encourage that we look at what types of waste are accepted there. And if they, it does come with complications, but accepting business waste from small quantity generators would be a huge benefit to our community. And then long-term, probably the cleanest solution in the long term really is to support a product replacement program for vaping devices. Next slide. So product replacement programs are brought through Department of Ecology and the Washington State Legislature. They provide funding for produce. I wrote these slides. Product replacement, not produce replacement, to help businesses that want to transition away from toxic chemicals. There are currently in our state many product programs going. So PCB light ballasts, receipts, recreational foam, dry cleaning chemicals, batteries. There's a new one that just went into effect for batteries. So you'll notice like you can bring your LCD PCB lights back to Home Depot or certain participating businesses, and they will recycle for you. Next slide. So product replacement programs will provide reimbursement funding for participating businesses, collection and disposal services. It's just a big recycling program essentially, and opportunities for certain businesses like paint companies. There's a product replacement program for paint. They can transition to less toxic options. Importantly in this conversation though, is product replacement programs put the cost, some of the cost of the disposal back on the manufacturer. So in the case of vaping products, that is something that we would say, yeah, if you are selling these products to our students, you're bringing them in our schools, you're presenting risks not only to human health, but to environmental health and to our physical facilities, then we want to put some of that responsibility back on the manufacturer to pay for that disposal. So our schools aren't paying for it and our taxpayers aren't paying for it. And or parents, even if the schools transition to, hey, give them back to the parents, then they're paying for the disposal and figuring out what to do with it. Yeah.
So I apologize. I got a whopping migraine going on, so I'm slower today. But are you saying, that was going to be my question to you. Are you saying, are they, out of the sales that those vaping companies are doing, are they taking, is there anybody coming, are they being taxed on that by the state?
Not currently,
That's what I
no.
was
So
gonna
this,
ask, okay.
this would be the end goal, and this is just my opinion, but I know this is also the opinion of others that work at, ecology and Department of Health and some other agencies, that this has been discussed. This is a long game though. The battery replacement program, product replacement program took years to put in place because this has to go through the legislator. So it's not a short game thing, but it is something you may hear me come back, talk about a little bit in terms of supporting, if there is a movement to get this going through the legislator, then we may come back and talk about it a little bit. But ultimately, I think this is the cleanest solution in terms of costs. But in terms of what to do with the product, we still need to get better options on facilities for disposal, ideally here in town, just to reduce some of those barriers and costs for our local schools. And our school program will be continuing to work with our local schools on this topic, and just helping them, with what we can in the immediate term to keep those risks kind of at bay. So that's a challenge we've been facing and working through, and I'm sure I'll come back and talk about it a little bit more, and hopefully, on a positive note.
Have you talked to like Stephanie Menard, April Connors, Matt Binky on any of those things?
Not yet. Carla and I were talking about doing that. Yeah, probably early spring.
Yeah, if you need help on that, let us know, because I think that's important. I'm kind of anti some of the taxes when I first came to the state. When it comes to B&O tax and some excise taxes, that this state is kind of different from other states. I mean, we don't have a state income tax, but I think on things like this where there's an expense, and I think it would be a good one. And I don't think it's a hard sell to go to the state legislator to get that one done.
Yeah.
I really don't.
Yeah, and our schools have been great with this, but ultimately the concern from a public health perspective is if it gets too difficult to throw, to dispose of, people are either gonna start just throwing them in the trash, which we don't want these ending up in our landfill. Or, the alternative is if schools stop confiscating them, then that's an issue also. So we wanna provide, a clean disposal route so that it's easier to kind of balance both of those public health aspects there.
Have you teamed up with so for instance, when you mentioned Bernard and everyone else?
Yeah.
Have you teamed up with other health districts around Walla Walla, for instance, I don't know, Perry Dozier?
Yeah, yeah.
He would be supportive of this too.
Mark Clicker.
Mark Clicker and those guys in Walla Walla. Have you talked to other health
Yeah.
districts and done kind of the same thing?
Relating to disposal, yes, there has,
The fees, tacking it on to the companies.
yeah, in terms of the product replacement
Yeah.
program, yeah, that's something that there's a specific group at the Department of Ecology that just does product replacement programs, yeah. And so recently we had a pretty big kind of informational forum, and it was surprisingly, it was attended by people from Texas, from New York. It was giant. So this is not just a problem here. It's clear that it's a problem in many places. It's not unique here, but it is becoming more and more of a problem and becoming more highlighted as, like Kelly showed you those graphs where vaping is going up. So we're starting to see the effects on the environmental health side of the schools being a little bit more worried about what do I do with this now?
I think tomorrow, I was supposed to be in Olympia, but because of the weather for the legislative steering committee for our Washington State Association of Counties. Tomorrow, if there's some times at 8 always on here, but I think I might bring that up because we'll have all the different county commissioners in there. We have our lobbyists in there and stuff like that. And they can push that stuff too, because they'll be talking to all the state legislators here.
Yeah, we would appreciate it, and
Yeah.
the schools would.
I appreciate that. That's a good presentation.
Do you know if there's an age limit on buying those? I'm never.
So in Washington State, we have tobacco 21. So
Okay.
any both cannabis because of the legalities around cannabis, and then tobacco itself, the 21 is the age limit for purchase in the
For
stores.
tobacco,
For all the vape products that should.
for vape as well.
Yes, Yep.
Okay.
So, yeah, no problem. So that is the success we had a couple years ago, is getting tobacco 21 in place so that we're dealing with, one of the goals behind tobacco 21 is that you don't have 18-year-olds then in the same school settings who can then buy product and easily distribute to their friends, right? So we give a little bit of buffer between the 21-year-olds and then the high school students. But clearly access is easy. Online sales, lots of ways for the youth to access.
Can I ask one more question? I know that you guys had, when you showed your graphs, and like I said, bear with me because I'm a little sore today. You had Benton-Franklin, you had a graph there, you had a state graph. And I'm just wondering, because I like to just drill down on things. You had Benton-Franklin, but how come they didn't do Benton County, Franklin County, and then even drill down a little bit more for geographical areas? Because if you kind of drill down and you know where those areas are, maybe you can get a message out more. I mean,
That particular data is from the Healthy Youth Survey. So those
Okay.
are the questions that are asked in school settings.
okay,
So the other thing about that data is 2021, obviously, when we take that survey, we are waiting for this next round of survey information to see if there's any true trends. Because that was when kids were just transitioning back to school after being home for a long period of time, right? So the mental health impacts, those things we were seeing in that period of time, we are waiting to see what those trends will look like for the spring. Until this year, Franklin County has only had one school district that has participated in a Healthy Youth Survey. That means that only the school district itself can get that level of data.
Yeah.
So we can't get county level data for Franklin County when you don't have more than one district providing information. We are very hopeful that this year, we will be able to easily see Benton and Franklin County data separately, as well as the combined data set. But in the past, we've had to wait for the surveyors at the state level to provide us with a combined county data set so we can even see any of Franklin County information. That said, to get to your level of questioning, it would be up to the districts to allow that more finite level of like Pasco School District, Kennewick, Southridge School versus Kennewick High School, whatever that looks like, because it's from that level of data, it would be the school districts that would have to kind of consent to get us that granular.
It's not trying to segregate. It's like I said, you got the macro level, you got the micro level. And once you start doing that, you can really start zeroing in.
And
help
where do we want to do our interventions?
Yeah. Okay, thank you.
Erin, you mentioned something about the manufacturer absorbing the cost of the disposal. So where are these vaping devices manufactured? Are they manufactured overseas? You know, I mean, how would you get to that level of?
China.
I don't know.
No,
That's for her.
No,
He's not wrong. That's definitely, there's a significant amount that are manufactured overseas, some in the United States as well. So it would end up at needing to be on the distributors, right? Those that were making money in the US that would taxable. We obviously wouldn't be able to tax that manufacturer overseas.
That'll also up in price. I mean, you know, the manufacturer never pays the tax. so
Correct.
I'm not sure if it's
Absolutely,
worth
it does
pursuing.
come back around. But if it,
If you get pushback on that, could you follow up with a question that says, asks about regulations that prevent the schools from using UPS and sending this right back to the manufacturer?
Yeah,
Is that an option?
It'll be interesting. Yeah.
Because UPS can send those,
Can transport those lithium batteries.
That's what all these great attorneys that we work with.
That is part of the complication is that, you know, like Carla mentioned, a lot of them are being bought online. And from what I understand from that webinar we did with ecology is that a lot of them are just now, you know, rebranding and rebranding and rebranding. And so, you know, they get caught and then they just shut down and rebrand as something else. So it would likely not be an easy product replacement program, but anything that would cut down some of the costs for schools, we see as a positive, because right now they're absorbing the entire cost of it as a business, or having to make the decision to not confiscate, which they're not doing, you know, and they, you know, as they shouldn't. So it's complicated.
You know, one more thing, just real quick, is I know that the 1-800 number or the number you had where they can go ahead and if someone wants to stop, whether it's vaping or quitting, and that information and that counseling could be downstairs or wherever it is at those kits. I think that's a great thing. I mean, that would be a good thing for some of the, maybe do a media with more of the media stuff with some of the news channels here.
we did actually have some primetime media.
I heard you guys on the radio
Yeah.
sometimes.
Okay, because I think that's a great idea. I was talking out of the blue, a mother that I knew from some of their kids that I had coached before, and two other children, they started in high school, and one's trying to quit right now because I noticed when I just ran into her at Target and she was buying lifesavers. I said, "Oh, I got lifesavers in my office." And I think they're wintergreen or mint, and they're going to try to use those to try to get them off of vaping.
Exactly behind the point behind it's that the hand to mouth, the oral change process to try to eliminate that. And then the 1-800 numbers, but there are a lot of resources that we have invested as a state in our tobacco quit line, vaping quick line. They will kind of do an intake and refer them to more youth friendly services or services appropriate for the caller.
I'm gonna be making a circuit around some of the city councils that I haven't met some of the new city council members, and so I'll bring that up to their city councils too, and so, you know, maybe they can push that out in the cities and put it on their website too. So that's really good information. Thank you.
All right, thank you.
Strategic plan.
Oh,
update.
yeah.
All the fun stuff.
Okay, so our communications coordinator who made this absolutely beautiful, she's new, her name is Sandy Soundkelly. She wasn't able to be here. She's working on overnight warming centers right now for Christian Media. That was the case. But she did a wonderful job, so shout out to you.
Thank you.
Yeah.
So, welcome everybody to hear our update about the strategic plan. I'm Carla Prox, Senior Manager of Community Health, and oversee the Performance Management Department here at BFHG as one of the areas of service. And we kind of, performance management system has the strategic plan as one of our key deliverables. So our previous strategic plan term ended in 2020. As you may know, we were a little busy that year and didn't quite have the capacity and resources to really wrap up that strategic plan as well as do the planning for another cycle. So that's where we are in 2023. You can move to the next slide, Eric.
where we said, you know, we have reaccreditation looming. And so clearly we knew it was time to refocus our efforts on a new strategic plan and get ourselves back in organized to move forward. So our timeline here in May, you can see that with, we reviewed the previous strategic plan. We looked at that and identified areas of success. And I will say that some of the successes happened because of the pandemic, not just despite the pandemic. So we did have to acknowledge that effort. And we also looked at those areas that we still needed to work on. What were we not able to complete because of strapped resources, timelines, et cetera? And what do we need to make sure we carried forward from that? We considered foundational public health services, which, you know, we've talked to you about before, and its impact on our staffing and that of public health throughout the entire state. And we also conducted a literature review. So there's a lot of publications that highlighted where public health needed to improve post-pandemic. So there was a lot of research for us to review, which you'll see highlighted in your plan. This allows us really to consider not just what we need to focus on internally, but what public health needed nationwide, and how do we stay in alignment with those efforts moving forward as we build this new strategic plan. So in June, several staff virtually attended the annual Public Health Improvement Training Conference, and there were several sessions on strategic planning. And we were introduced to a concept called Agile Strategic Planning, which was really interesting to us. It explains why our current strategic plan we're presenting you today really is only slated to cover 18 months, because our goal was to get back on track, kind of right our ship, focus on the things that we needed to focus on getting oriented post-pandemic and with leadership changes, and really say this is where we want to move forward and make sure we're solid. And we will certainly in 2025 be working on refreshing kind of a longer vision. And then, sorry, we'll keep moving on. We also held a strategic planning retreat where the team worked to narrow down our needs into four priorities, which we'll go over today. We used our tactical processes, lots of sticky notes all on the walls, categorization efforts together so that we could just focus on knowing what we needed to work on and how do we group those together. Amanda's going to talk to you about the rest of the timeline.
Thankfully, no tears, maybe just a few.
Okay.
So by the time I got involved, it was around August. And so kind of looking at what some of the priorities were, communications is a huge component of what we're doing here at BFHD. And so there wasn't too much to write home about. So unless there's something I missed, please let me know. But pretty much from August until now, we basically had groups we went back and forth. We had multiple sticky notes. Janae had massive sticky notes in her office. We had whiteboards, erased, copied, you name it. We really wanted to hone in exactly on what we needed and to be truthfully honest with ourselves. And I think that's what's really awesome about the strategic plan is we're vulnerable, we're honest, we're going to be transparent about it. And there are some things that we need to work on, but through everything, our staff has been absolutely phenomenal. So despite the things that I know we need to work on and continue to improve, or at least continue working on, we do have an incredible group of people that work here at BFHD. So we're excited for the future.
So as Amanda mentioned, the documents in front of you that she and Sandy worked tirelessly on throughout December, so we could be ready to roll it out to you and staff here in January. Next slide, Eric. So it's typical to refresh an organization's mission and vision and values during a strategic planning process, but our steering committee chose to keep ours as they were. We really felt that they were still meaningful to us, and it helped us support that agile planning process by saying this is an area where we're not going to focus a significant amount of our time. So you'll see that throughout the rest of the process. Next. So these are our 4 priorities. Amanda, you want to talk about the first one?
Yeah, so do you want to go into each specific
or just high level first?
Just high level? Yeah. Okay, so first one is improve trust. You can see that that's the only one that has 2 goals. Again, it is a very important topic. It's both internal and external is what we're going to be focusing on.
And then we know that workforce development is pretty critical. Well, we need to cultivate that knowledge. We have new human resources staff. We have a lot of new staff at Foundational Public Health Services. We retained some great staff from our pandemic funding, and we need to make sure that we're all being developed together and really modernizing a lot of our efforts there. Organizational structure is the other priority area, which is kind of just as it looks like, it's a place to lump some things together that we needed to capture there. And we want to just, focus on the fact that we are continuously refining and assessing and enhancing our organizational systems and structures. And we have some specific objectives we'll share with you.
And it's exciting too, because emerging public health issues was always something that's coming down the pipeline. So as you're hearing about it, we're hoping to continue to be proactive and not reactive. And there's a lot of information, a lot of good work that our staff is doing, and looking forward to seeing what they can accomplish this year, or at least the next 18 months. Okay, so next slide. Oh, one more before that. Okay, so trust. All right, I've been entrusted to share trust. Okay, so I spent a lot of time really thinking about how I wanted to explain these two goals. And so what Carla and I did is kind of sat down and focused on some of the key points. So you'll have a little bit more in depth in your strategic plan in front of you, but this is going to be a big highlight on what we're doing. Within the strategic plan, you'll also see that you'll have not only just the sentence, but behind that are many, many objectives and many different ways that we're going to approach this. So I can only speak on behalf of the communications lens. And I know when I first got involved, we had some broken trust. We had some issues. We had some things that we needed to definitely look at. We had a lot of silos, and we really wanted to work on a healthy culture. And I think that's what's been really exciting to improve the trust within BFHD is first and foremost very important. Again, none of the stuff was impacting our community, but it was definitely in the point of making sure that we're retaining and keeping all of our staff and making sure that our communication is clear. So looking at kind of a healthy culture, what that means is, one example, I know Janae was really championing this objective, which was exciting. So we kind of went through, again, all the sticky notes. I know we had a great conversation with Carla because she was able to really hone in some of the language. But really it's about working as a team, and we're learning along the way. So the goal is to adopt a shared value system within all of our leadership. We have some incredible leadership, but because we've had some leadership changeover, we've really wanted to hone in on exactly what we're all looking at together and being on the same page. And having so many different programs and so many wonderful things we do, we really wanted to find some consistency in our core values and maintain that through all of our communication. Some of the things is ethical executive leadership. We recently had a leadership workshop, so it was our senior leadership as well as some of our supervisors and managers. I was excited to also be involved in that. That was really a great time for us to really look at what we wanted to accomplish and what we wanted to do in order to improve our staff. What I've learned is we're able to learn a lot from each other because we do have some very incredible leaders here, but we've never really had a chance, I feel like, from the small, short time that I personally have been here until not too long ago with changeover, that we were really able to look very closely at our core and what we would like to accomplish moving forward. So when we're looking at that, we're also looking at clarifying roles and that communication flow, very valuable when you're having multiple balls up in the air. Through an HR lens, we're providing consistent, concise policy and procedures. Then we're also looking at recruiting and supporting that ethical leadership, opening up opportunities for our leadership to continue to grow, learning different ways that we can start empowering our staff, anything that is possible to continue to improve that open communication. And improving internal communications is very, very valuable. That's something that we've worked very hard to do. I've heard some good positive things from staff, but I still believe we could be better. Throughout some of the changes, I've seen a lot of our senior leadership really come together and really be open with staff, and as quickly as possible getting and disseminating that information. So it's been a complete 180 since I've been here, which has been, phenomenal leadership is what I can contribute that to. So what we're seeing is transparent and being consistent communication, conducting internal assessments. It's not enough just to say, hey, we're going to do all of this, but we want to go to the nitty gritty and into the weeds. What does each department need and where are some of the issues? And so our leadership has really been able to do that. Also offering ways to maintain accountability and be heard. So finding that system and that procedure for staff to be able to receive some feedback if they have a complaint or something that's going on. I know our HR team could definitely talk in depth about that, but it's been fun. Recently, for an example, I was in the room with Janae and Brandy, and we were sitting down and they were open to my idea. I walked in, I said I had an idea, and I thought, everyone has these performance reviews, but there's no tools to actually focus on the performance improvement that you might need to make. What are some of the tools out there? Sometimes you're just left up to figure it out on your own. So what can we start providing to our staff? And that's just one small example of some of the things that we're going to be working on and fine tuning. If it's not right now, it's not on fire or a priority, move on to the next. And then I'll quickly go through my favorite, Board of Health engagement. We want to engage more with you. I know our staff are hungry to be a part of understanding you and having you understand our programs. So this is going to be really great in order to have some feedback, as I'm very grateful that y'all were open to the DA survey that we put out. Maybe there's some Board of Health survey of things that staff would like to know from you or like for you to be involved with. This is just the beginning of really offering that. We're really changing the status quo. When I first started, I technically wasn't necessarily allowed to talk to Board of Health. So this is a really wonderful chance to break a lot of kind of those silos down. So it's different.
That one there on the Board of Health engagement, I know I did a tour and I think it was helpful. It was pretty interesting, but you know, I know we have a lot of different board members and I would like to do one again too. Is go around all the different departments and be more educated on what everybody does here. I think it's important. If we're gonna be board members,
Oh, yeah.
that is a huge thing to do. And maybe to our health official here is, that would be one thing. I know that maybe get some feedback and that would be a good one, just to let you know. I think that's really good. And that when people ask me, hey, you're on the Board of Health, what do you guys do? Well, I can tell them on some of the stuff, financials and but here's all the different things within the Benton-Franklin Health District and stuff. So anyway, I think that's a really important one. That might be another step we could go ahead and do.
Awesome. Well, we look forward to your feedback on that. And I know Nurse Family Partnership would love to have you on a trip. I know Dr. Giske just made one, our food inspection staff.
Someone had reached out to me on that. We were super busy on a couple of things with the public safety sales tax and a couple other things pivoting with it. But yeah, I would definitely do one.
Yeah.
I'll reach out again.
And I'll go through the goal 2, improve public perception. I know we only have so much time, so I'll kind of, I gotta go faster. Basically, we're gonna do a new brand. We're looking at rebranding in March. That will mean that Board of Health, as well as all staff in the community, will have some sort of conversation with that. So we will keep everyone involved. It's a new era. It's a new BFJHD. We're ready to take it to the next level. We have, you know, new faces on the board as well. And so the goal is to connect people with people and really connect our community with our subject matter experts, because that's one of the best ways we've been able to find messaging is important when it's coming from somebody that you trust versus just a message we send out there. And then quality of communication. Again, we're looking at transparent, inclusive, equitable, valuable. We're really grateful for all of our local media stations, including Tumbleweird, who puts out a lot of content for us. The Tri-City Herald as well. I mean, we have some incredible people out here that are willing to give the information. And then we'd like to modernize our website. We found out on the after action report that it's not as clear sometimes navigating that. So we are going to be working on that. Give us some time. And we hope to have maybe a new website in 2025.
Amanda. So next slide, Eric, keep moving. Our second priority that we talked about was workforce. Okay, so our goal here is that BFHD has a knowledgeable, skilled, and confident workforce and is seen as a positive and desirable place to work, right? We want to make sure staff have what they need and that they want to be here and work with us. So when we look at that effort, where we're looking at is really improving the process for orienting to management and leadership positions as a start of succession. We want to make sure we identify those staff that are really promising and make sure we have good strategies and processes to bring them on board. We want to modernize all the components of performance evaluations across BFHD, like what Amanda was sharing about. You know, we want those performance plans to be really helpful and impactful for staff and help them grow in areas that will serve us and serve them in their development. Improve recruitment and retention strategies and onboarding processes for vacant positions. We don't want people to feel just like when they walk in the door here as new employees. That's not the environment we want to set the tone for. So we're also looking at creating a workplace environment that's supportive of employee well-being. We did a lot of work on that during the pandemic, understanding the extra stress folks were under, and we want to continue that quality culture here. Also looking at delivering comprehensive workforce training, which covers various essential public health topics to staff, and enhancing with our new human resources, some training specifically tailored to supervisors and managers to continue developing that process and making sure we all have some really good, clear expectations of the work that we do, and we do it consistently and together. And again, what I ask of you all is if there's areas that are of interest to the board members, and if you have questions about this particular priority before we move on. Okay, there's areas that you guys feel particularly engaged to act on, just let Janae know, and we'll make sure that you have some input in the processes as we move forward. The next one is our organizational structure. Like I said, that's kind of that bucket, right? That contains a lot of different topics. So our goal is that BFHG evaluates, refines, and improves organizational systems and structures. My performance manager would be remiss if I didn't say quality culture at BFHG. That's really something that we do as part of accreditation efforts and our effort overall. And so we're looking at developing and updating financial planning practices. We have a new finance manager on this year, a lot of new staff and executive leadership. We want to keep things consistent, know our timelines, keep our really good audit record as we move forward. And so make sure we have all those great processes documented for us. We want to improve the use and awareness of public health performance management structure to align our agency work. So a lot of places when they hear the word performance management, that just means staff performance, like you're managing staff performance. In public health, the performance management system is really inclusive of things like our strategic plan, our community health improvement plan, our workforce development plan, our quality improvement plan, as well as those individual performance evaluations, the branding and communication strategy, that all kind of lumps together as this performance management system. We want to make sure all of those things are aligned so that we're all doing things together, collective impact internally, Carol. You'll know what I mean there, so that we're not heading in different directions with that work, that we're staying in alignment there. Of course, we want to replace outdated organizational practices and systems. That's not just us at BFHG, that's actually really clearly comes forward in the literature reviews during and post pandemic. And so that's something we want to continue to follow that lead, make sure that our data systems are clear, that we have modern human resources systems and financial management systems and the things that we need to do our work. We want to achieve FABRI accreditation. This is a huge area of focus for us, and we are in the home stretch. We have to have everything submitted by February 14th. So we're really getting all of our ducks in a row there, and that's a big goal of ours this year.
So that's an acronym. What does that stand for?
Public Health Accreditation Board. And then they are the ones who accredit public health agencies to show that we're good stewards of our resources.
It's an intense procedure.
Absolutely. And you can be sure we're going to share it with you. Yes, as we move closer. So again, we want to improve our records management processes. Prior to the pandemic, we were on our way. It's one of Janae's passions to move forward with that. But we also know that during the pandemic, we learned so much, and there were additional lawsuits that came forward and legislation around records management and public health records or public records. So we want to make sure that we are staying our systems are well aligned for that effort. We also want to refresh our organizational meeting structure for BFHG. We want it to be meaningful and aligned, but not cumbersome. So we're taking the processes that we had and actually presented to the Public Health Association conference prior to pandemic and looking at what really works about that process for us, and then kind of cutting out the extra so that it can be really useful for staff. And I will hand it off to you for the last priority.
Any quick questions on that? Okay, priority number 4, and I won't talk so long. Okay, emerging public health issues. BFHD coordinates evidence-based intervention policies and procedures to address the emergence of new public health issues and prevent the rapid spread of endemic public health issues. Okay, so environmental risk factors, as you know, we are encompassing, we're talking about toxic algae, we're talking about wild smoke, extreme temperatures like heat. We're taking a look now at our warming centers as well as our overnight warming centers. And right now, actually, as I mentioned, overnight warming centers is what our current communications coordinator is working on. Big shout out to Benton-Franklin Transit for hosting our temporary warming center, as well as offering a chance to warm up in their buses. But really a part of this conversation is increasing our participation in local state environmental policy act, and also seeking partnership and funds to support data collection related to nitrates in groundwater. So there's a lot that we're going to be looking at, and developing a model for our local climate health program that's refining our process and response and sampling to toxic algae. Possibly planting some more trees. I mean, there's a lot of things that we can do. This is actually a picture. All of these pictures are from BFHD. So those are some of the kids that participated. We have several staff members that went to that tree planting ceremony. And then we're also looking at this through a One Health lens. Our goal is to really focus on that human animal environment and integrate that. So for example, toxic algae, we would like to get more connected with our veterinarians, you know, really honing in on the health of both human, environment, and animal. And something that I don't know if you know, but 3 out of every 4 new or emerging infectious diseases in people come from animals. And 60% of human diseases can be spread from animals. So really finding that One Health connection is something that Heather Hill, our deputy to the health officer, is really engaging with within our staff. And it's going to be fun because I think it's going to impact as well our agriculture community and everyone else. So we're excited to continue that and implement and monitor CHIP.
Next slide. So in closing, we wanted to make sure that you know that we have plan alignment. I mentioned about our performance management system, and part of our process for reaccreditation is making sure that not only for reaccreditation, but because it's important to make it really meaningful to our agency, our strategic plan has to be closely aligned with our community health improvement plan, our workforce development plan, and that performance management system plan. And for monitoring and evaluation, we want to document what we're doing and make sure we know that it's happening. And so we use a performance monitoring system called VMSG, where we can put content in there. So that system is going to require monthly status reports on each of the metrics that we've outlined in the plan, quarterly evaluation in our agile process to make sure that if we need to do any plan revisions or refine the objectives at all, we'll make sure we're doing that quarterly, and report outs every 6 months. So we'll be interested to hear from you all how you'd like to see that. How would those report outs be meaningful to you so that we can be prepared for our 18-month victory lap?
Questions? Threw a lot at you. You'll have a beautiful document to
No,
look
I
at.
think to build a relationship better would be having donuts every month here.
Okay, all right.
Builds a relationship.
Do you remember what kind of agency we are?
Oh, that's.
Tell us you're eating
Apples?
apples.
More carrots.
Okay, we can do that.
Thank you. No, I appreciate your time and that good job on that
Yeah, it was
too.
really good job.
Thank you. Ms. Janae.
Yes, so in your packets at the very end on the left side is a resolution. I'm gonna make this very quick for you all. So I know we've got some other business to get through, but this is out of recommendation from Endurus, our liability insurance company. To be in compliance with RCW 4.96.020, we need to have an official appointment of an agent to receive claims for damages, like if there was a personal liability. And so we need to update that, and so that's what this resolution is here. Chris has reviewed that, prepared this for you all here today, but we just want to get it formally approved, adopted, and on record.
Yeah.
So,
I'm fine with it.
Yep.
We get a motion.
Go ahead.
I motion that we approve the resolution to have an agent appointed to receive claim for damages.
I'll second that.
Motion is second. All in favor, say aye. Aye.
Aye.
Aye. Thank you. Moving on. Oh, we gotta do that. I forgot for this.
yes.
Election of officer positions.
Yeah, so in our charter, we are required to every year reevaluate our officer positions. The current sitting chair and vice chairs have the opportunity to be renominated for a consecutive year. Otherwise, it's up to the majority of the board to select their new chair and vice chair. Okay, no pressure, sir.
You want to do it again?
As long as there's more donuts, I'll do it again.
Hey,
I'll
I
work-
had
I'll work
the
on it.
judge, district court judges, I made them talk, they had ring donuts, so. I got you.
We really put you through the ringer, so if you want to stick it out with us.
No, I don't mind it. I don't mind. I like communicate with you guys and stuff, so.
I'll nominate Commissioner McKay, and so whatever, I'm open.
I'll second.
It's pretty easy.
Dang it. I have a motion and a second. All in favor, say aye.
Aye.
All right. Any opposed? All right. And then vice chair. Who is the vice chair? Is that
It's
Mullen?
yeah.
Okay.
Is he on by chance, Commissioner Wallach? We see him pop in.
He's
I
playing
think I heard
hooky.
Marcy's voice.
Perfect time to.
He's probably
nominate him
drinking.
then.
What about nominate Clint?
Hey, Clint, you want to do it?
Yeah.
He tune out.
What?
So make a motion. Go for Clint. Yeah.
I move that we elect Commissioner Didier for vice chair of the board.
I'll second it.
A motion and a second, all in favor, say aye.
Aye.
Aye. We'll make you guys
Any
work.
opposed? Any opposed?
Nay.
Yeah. Congratulations, Clint, the ayes have it. All right, is there any announcements? I think we had a lot of announcements today, so I think we're good. All right, approval of vouchers.
I have the originals here.
Yeah.
Anywhere you want.
We need to get them. Or do you want to review them real quick or just get them? We need to get a motion. I looked them over.
So we're gonna approve resolution 2401. It's all.
Number 8, we're on the second.
Number-
Yeah, yeah, sorry, I got that.
Yeah.
Flopping heavy.
I know.
Okay, move to approve the Board of Health, payment voucher numbers 96 2023 through 103 2023 and 01 2024 through 04 2024 in the amount of $1,769,953.04.
Second motion.
We have a motion and a second. All in favor, say aye.
Aye.
What was the last vote? Was it, this seemed like just a couple hundred. Is this about the same price as was?
No, this would be worth of 2 months worth.
Yeah, okay, that's why it's different. Okay, yeah.
Yeah, it's a little higher
Yeah.
than normal.
So we had a motion, we had a vote, right? We already
Yeah.
passed. Okay, good, perfect. All right.
Don't confuse me right now.
No, yeah, sorry. All right, moving on to some executive sessions.
Yeah.
We doing all three together or?
No, they're all
can we break
separate
out-
'cause they're all
break out
different.
separately?
Yeah.
Okay.
Yeah.
All right,
So the first one, if you want to call that, and then we'll need Chris Mertens, Brandy, and myself
okay,
for 10 minutes.
for 10 minutes, okay. All right, so we will, do we need a break before? We good? Just get going in it?
Oh, wait,
All right. All right, so we will move it to executive session per RCW 42-30-110-1I for 10 minutes. The time is now 2:40 to include,
Board, Chris Mertens, and Brandy. and myself.
there you go. Perfect. That's Marcella too, right?
Yes, Marcy and Commissioner Didier.
Yeah. How you doing, Carol? All right, we are out of executive session. The time's 2:52. No decisions were made. We'll be going back into executive session per RCW 42-30-110-1G for 5 minutes. The time is now 2:50. I'll go 2:53.
To
Yep,
include
that's
the
like
board, Janae and Brandy.
Yep, to include the board, Janae and Brandy. All right, we will extend our executive session. The time is 3:01 for another 10 minutes. We're recording? All right, we're out of executive session, time 3:13. We'll move back into executive session per RCW 42-30-110-1G for public component for
12 minutes
12 minutes.
to include Brandy, Janae, and the board.
Yes, what she said.
All right, so Commissioner McKay had to step away briefly to use the restroom. And so he's just asked me to call the meeting back to order so that we can extend the executive session 10 minutes to include the same group of individuals.
All right, we're out of executive session. The time is 3:40. No decisions were made. We're going back in. Is this called like
A closed session,
Yeah,
yeah.
closed.
And
Closed
just read it aloud, yeah, like normal.
Okay, so it's review of a collective bargaining, RCW 42-30-140-4A for
5 minutes.
no way. 10?
10 minutes,
10
that's
minutes.
what Brandy says,
All
and
right.
to include Brandy and myself on the board.
All right, perfect. It's now 3:41. All right, we're out of executive session, times 3:53. With nothing else, this meeting's adjourned and we'll see you next February 21st. Have yourself a fabulous, snowy, freezing rain evening.